Good evening, everybody. I'm going to give a few minutes to allow some people to come in um, before starting my live tonight. It's going to be very informal in a sense, but it's more so educational purposes. Um, and each live that I'll have from this moment forward to kind of build on, the ultimate goal of expounding on what is this program that I'm talking about and how it not only help patients but also facilities and practitioners as well. And while I'm waiting for people to come in, once you do come in, just tell me where you're watching from or where you are. Um, Also, put below like if you're a patient, practitioner, um, nurse, or whatever you may be, or whether you just here just to learn and kind of just see, what is this program or what is this thing that I'm talking about. Just put all of that in the chat below. And also, if you do have chronic conditions and you're here as a patient who are dealing with chronic conditions, like put down also like what is the hardest part about managing those conditions. And then I'll just kind of circle back around. Maybe not on this live, but if I see the comments come in, I'll try to answer as I go along, but circle back and maybe make videos just trying to answer those questions with as much information to the best of my ability. So first of all, in case people don't know me, thank you for joining my live tonight. Tonight I'm going to go over like what is chronic care management and why does it matter and why is it so important. My name is Amber Austin. I'm a registered nurse. Taking a break now from my master's program. I was working on my master's of science in nursing, concentrating on health systems leadership. When I first started nursing school and I first went into the healthcare field, I had no idea that I would be in this place now as far as being interested in on the insurance and chronic care management side. Everybody go to nursing school or whatever and they think, bedside nursing or nurse manager, all those things, right? With your hands on. No one actually think about the other side of it, which now we're seeing a lot of issues, and people trying to strategize on how do we prevent, patients from coming back to the hospitals for the same old issues, or how do we prevent them from having recurrent exacerbations from their chronic diseases? Um, and what is the solution to all of this? Um, Me, I'm a researcher. The information is there, but you really have to dig and you have to know. Thankfully, when I got out of nursing school, I was allotted the opportunity to work in cardiovascular recovery at Baptist South Hospital. The heart is absolutely amazing. I absolutely enjoyed my time there working with the patients. Um, but then I kind of moved transition over to dialysis. And as a dialysis nurse, I mean, the heart and kidneys go hand in hand. If you're in the medical world, if the heart goes, the kidney follows. I mean, that's just how it goes. You have a hypertension and it's uncontrolled, diabetes uncontrolled. Eventually, the kidneys are going to be affected, and every other system within the body also will be affected. So, dialysis was really great, but then there was always this consistent thing of patients being like, well, I called, my doctor and I couldn't get anybody, or, why are you not being compliant? Or why are you not following, your regimen? Well, I didn't know what to do. It's always, I don't know. Like, there's always a I don't know, or I was going to try to wait, until later. And I just made a post on LinkedIn. Like, later is the most costly word in healthcare now. And you can go to LinkedIn and read that post and, delve into it. And maybe I'll post it on Facebook. But tonight I'm just going to move on because I could talk forever about this. But I want to talk about something um, that's changing in healthcare across the board. And if you're on the live, thank you for watching, and I would greatly appreciate it if you guys share the live. amongst people, you may not be interested in it, but it may truly help someone else. So once upon a time, um, healthcare was this highly profitable thing, right? Where back in the day, insurance companies, paid a bunch of money. The sicker patients were, the more procedures doctors perform, the more money they make. Well, now healthcare is it's moving away from how sick you are, and reimbursement and payment actually is determined by how well and how compliant patients are. So now you're getting this change in what healthcare really is about. So after doing all those bedside, the patient care jobs, I ended up working at Jackson and doing case management. Had absolutely no idea what case management was. Read the description, I was like, that seems like something I'm interested in. Applied for it. Months later, they called me back. Absolutely loved it. Life changing. It was like a calling where I could educate, and I like teaching. If people know me from nursing school or any of my professors on here from nursing school, like I just love learning and being able to teach people and break it down to a level to where they actually understood what was going on with them. It builds like a trust, and also it gives them the knowledge they need to be successful. So case management really changed my life and my world as far as how I viewed healthcare versus always, trying to think of like, how do we prevent this? Case management gave me the mindset and the tools to research and figure out, well, there are ways to prevent rehospitalizations. There are solutions to this problem, but there's no one talking about it. There's no one giving this information. So what I'm going to do now is just give you what the technical definition of chronic care management is, or what you'll hear me say a lot, CCM. So chronic care management is um, Chronic care management is a Medicare supported program designed to help patients who have two or more chronic diseases. Examples of chronic diseases are diabetes, hypertension, heart failure, COPD, asthma, chronic kidney disease. The challenge is that healthcare traditionally focuses on short office visits, but CCM, chronic care management, it steps in and it fills the gap between the office visit and follow up appointments. So, in layman's term, you have a patient who, just say you have someone who has diabetes. Maybe they're on oral medication, maybe they're on injections, taking insulin. But also with diabetes, their kidneys may be, kind of not working the best, or they may have hypertension. Because typically, when you got a patient that has diabetes, what you see a lot of is, especially in this community in Montgomery, Alabama, you see a lot of uncontrolled hypertension and diabetes. So you have two chronic diseases already right there. You go to the doctor, you get your medication, doctor comes in because they're overworked, they're understaffed, they have tons of paperwork to do just to stay compliant. But they come in, they tell you, go over, review your medication with you, ask you, are you having any issues? After maybe 3 to 6 months of waiting for a follow up, to go to your follow up appointment, most times people don't remember those questions, or, if they've had any issues. Unless you're like my grandma, shout out to my grandma, Gertha Austin. She doesn't forget a thing, but that's not the case with most people. Most people, they forget stuff and they go on about their business. And it's like, oh yeah, everything is fine. You get all these medications, you go home, you take these medicines, and if you have diabetes and you have hypertension, you go home, you take the meds. You got two or three blood pressure medications, two or three different diabetes medications. Well, you take them in the morning. Then you're walking around today, as the medicines begin to roll through your system and you feel faint, or um, you begin to feel like kind of off, like you're weak. So you go sit down a little while, then you continue your day, but you continue to take the medications. Just say, or you skip medications, or you don't know what to do. But anyway, just say you bottom out your blood pressure, or you bottom out your glucose levels. You end up at the ED. Go to the emergency room. They tell you, well, hey, your sugar was low, your blood pressure was too low. So follow up with your doctor in 2 to 3 weeks. Blase, blase, blase. Here's your paperwork. Right now, you're good. X, Y, and Z. Do this, do that. Go home. Well, you go back home, you do that same cycle again, because even though the doctors or the case manager or the nurses may have told you, like, hey, check your blood pressure, or make sure you monitor your glucose levels prior to taking the medications. A lot of time what you find is a lot of people, they either don't have the equipment or they don't know how to operate the equipment correctly. Not because they were not shown, but because in the moment, a lot of times patients are intimidated when people come in and they educate them. So they don't ask any questions. They just say, okay, yeah, I understand. They go home and the cycle repeats itself. So what chronic case management does is we step in, nurses or whatever program is in place, you step in. Once you, when a patient leave the doctor or they discharge from the hospital, just say you discharge from the hospital, a physician who has chronic care management in place, they would have whoever's running operating that chronic care management program. You will reach out within 24 hours of discharge, and you will ask them, all these questions, go over everything with them, and you will ensure that the education that's needed is provided. And I always say, meet patients where they are. I talk to my counterparts in interdisciplinary teams, like with medical terminology, but when I'm talking to patients, from the moment I speak with them, I know exactly, pretty much what their understanding level is based off of basic conversation. And I meet them where they are and I explain it to where they understand it. So that's the point of chronic care management, is to meet patients where they are, explain what's going on to them, how they understand it, and also for us to monitor symptoms and prevent those hospitalizations. And where chronic care management prevent those hospitalizations is if trained clinicians or trained staff is aware of symptoms that could be leading up to exacerbations. Chronic care management job is to reach out to the physician and be like, hey, this is what's going on, how would you like me to proceed? Or like in the hospital, typically you have standing orders. So if I'm dealing with a physician, and of course chronic care management is with these chronic diseases, typically there will be standing orders. So as a nurse myself, I can, with the doctor's sign off, which, I could call in these prescriptions or advise a patient what to do to prevent, hospitalizations. So I mean, chronic care management is a lot. I know it may seem like I'm just rambling, but it's so much information. And I'm trying to really stay on task to keep the live at like 30 minutes and kind of get in and get out of here. So now the next question is, okay, chronic care management, Medicare. Oh, this is only for old people. No. There are younger people who qualify for Medicare. So, if you have a disability, anything like that, and you're getting Medicare, and also with Medicare, you can have um, dual coverage. So this chronic care management is service and is funded by the Center for Medicare and Medicare Services. So a lot of people who do have Medicare, whether you're 25 and you have end-stage renal disease and you're on Medicare, or whether you're 85, a lot of times patients who get Medicare, they also qualify for Medicaid. So you have that dual coverage. So I pretty much went over who qualifies. So qualify, generally you have to be Medicare coverage, two or more chronic diseases and conditions that will last more than 12 months. Any of the chronic diseases that I'm going to name, they're typically going to last more than 12 months, because most times once people um, find out they have these chronic conditions, they don't go back from it. So that's just unfortunately the state that we live in. Examples include diabetes, um, high blood pressure, heart failure, COPD, asthma, kidney disease, coronary artery disease, depression, arthritis, like even depression, anxiety. Those can be debilitating. And that can be one of your, chronic diseases. So it's a wide range of things. Like I said, anything that lasts or that is set to last more than 12 months, that's considered chronic. Um, so how CCM helps patient, it encourages medication adherence. It reinforces education, encourage screenings. A lot of times, patients forget to do those screenings. I like to always say, we want to be proactive and not reactive because a lot of times, most people say, well, hey, I'm fine. I don't need to go to the doctor because I've heard that so many times doing case management. Like, I was fine. Nothing was wrong. I don't go to the doctor unless I'm sick. That's a bad ideology to have. The doctor isn't for when you're sick. It shouldn't be. The doctor is to create a baseline. You want to go to the doctor as a healthy person so that way you can understand what your baseline is. So yearly you do your blood work, you know what your labs are, what they typically run and average. So if you see a change in anything, you know if something is going wrong. If your blood pressure typically is, 120 over 80, that's just the median. My blood pressure typically runs lower, so I know what my average is. When my blood pressures went up to like 118 over 77, that was, concerning for me. I gained weight. My diet wasn't just say the best, and I knew the weight gain played a lot into that. So, losing 5 to 10 pounds, which my doctor did recommend, that would substantially, change that. So it like I said, doctors are not for when you're sick, it's for to prevent sickness. So number one tool in healthcare is being proactive and not reactive. Making sure that your engine is running, efficiently, just like with your car. Hopefully, most people maintain their car. You don't drive on a hope and prayer that you have gas in your gas tank, right? You go to the gas station and you fill it up. So that's the same equivalent with our body. We shouldn't walk around every day on a hope and a prayer that we're healthy. We should go to the doctor to make sure to get that refill on and that confirmation that our bodies are still sustaining at a maximum level and that we're still where we should be and that we're not having any declines in our health. So, yeah, that's one of the things that could help a lot. But let me get back on target because I get off and go on a whole tangent as far as about things. But with high blood pressure, we encourage compliance. A lot of people. I see a lot of people that come in, young people. Montgomery, it's astonishing at the population, and a lot of minorities. African Americans. You see, because Montgomery is heavily populated with African Americans, and I worked at Jackson, so that community is heavily populated with um, that population of people. But a lot of young people coming in, 20 to 28 years old, they're saying, "Oh, I'm young. I'm enjoying my life. I'm in the prime of my life. I'll be okay." But they're coming in with end stage renal disease, coming in with heart failure because of the culture of I'm young, I'm partying, I'm enjoying life, and I'm taking drugs, pills, whatever it is that you're doing. So you see a lot of that, and the job of CCM is to educate. Educate. Like, no, is age is not a factor in chronic diseases affecting you. It used to be the older you get, that's when you became sicker. Now it's the younger people are being affected by this. So my job and what CCM is about is educating people, letting them know like, hey, you know, this is what's going on. You really need to take your medicine because if you don't take your medicine, my favorite thing is when they really just hardcore is like, hey, like I said, I meet people where they are. Certain people I can talk to like that. Everybody be like, no way, you say this to the patients, but how to talk to certain people. And I'm quick to say like, hey, I'm gonna be honest with you. I'm. Do you want to die? It's like, but I want to enjoy myself. I'm partying, da da da. Okay, so is doing X, Y, and Z for now having this temporary feeling, worth you dying or worth you not being able to breathe because you're in full blown heart failure, worth you not being able to spend time with your family, worth you being, stuck to a dialysis machine 3 times a week, having to get your blood purified and get fluid pulled off because your kidneys can't work anymore. And then after dialysis, your blood pressures are bottoming out. and you're weak, or either you're in the hospital, so do you want to go through these vicious cycles just for like this temporary thrill and feel? So, like I said, CCM is a lot of education. And if you guys are writing comments, I cannot see them, but I don't see any so far. But yeah, so the thing is now, why is healthcare shifting towards prevention versus, you know, a lot of procedure and paying? Years ago, like I said, healthcare focused primarily on volume, the amount of sick patients, the amount of procedures, the amount of surgeries. But today, in today's society, because as we go through the years, medicine advance, and also the cost, goes up on everything. But we're focusing on better outcomes, prevention, quality, and patient engagement. So for insurance companies, it is cheaper to prevent hospitalizations than to pay for them. So if you're a facility and you have chronic care management implemented, and you're a hospital or you're a provider, if you're saving insurance companies money, they're going to give you top dollar for reimbursements. So, and we see, the climate of today's society with, especially being in Alabama, with a lot of rural hospitals closing, and with Jackson, it's unfortunate, and the conversation around reimbursements. And, a lot of people are saying, like, what's the solution to this? Like, can we get the reimbursements, you know, increase? The thing is with reimbursements, yeah, you do have contractual agreements, but also insurance companies base reimbursements on prevention. When I work, in the facilities, a lot of times you see the same people coming back to back to back. They say, well, the doctor told me that I was fine. When I went to my appointment, I got my medication. I was doing what I was supposed to do, all of these things. And it's like, okay, well, if we're seeing that this provider who's connected to this hospital or this entity, if their patients keep circling the drain coming back to this facility, then we're not going to give you those reimbursements. And it'll all make sense. We won't give you the highest reimbursements when it comes to like Medicare and all these subsidiaries. And everything will make sense as we go along, because the point of these lives is to build on information. So we'll go into like what the CMS star ratings are, and there's a list out right now with the top star rating hospitals in the state of Alabama, who got 4 stars, which is excellent, because the top rating I think is 5 stars. So those facilities, and one of them being right here in Montgomery Baptist East, so they received 4 stars for CMS regulations. So what that's saying is, not only are you compliant with CMS regulations, but you're also filling in those gaps and preventing rehospitalizations with the patients who come to that facility, or the patients who see physicians within that facility, or within that scope of practice. So it's a lot of information, like I said, and it takes a long time to go over it. But a single hospitalization can cost thousands. Please don't go to the ICU or have heart failure. But a simple intervention, a chronic care manager calling, between appointments, or calling, because sometimes you can't prevent hospitalizations. That's just what it is. The point is not to prevent all of them. The point is to prevent unnecessary hospitalizations. I've spoken with some counterparts, and the current thing, as far as being a clinician myself, and also hearing providers. The common issue is, we see patients, but we don't have time. We're seeing so many patients. Either the day is gone, or they get caught up in emergencies where you want to call back, but you just can't call back that day. Then you call back the next day. That can be, that can 24 hours could be detrimental for someone who has chronic diseases, right? Because if they've been having noticing these symptoms, or they're at their wits end with it, typically people don't call the doctors for help until it's like, okay, I'm typically on 2 liters of oxygen and I'm able to move around, but now I'm noticing where I can't even move around and I'm coughing a lot and I'm unable to breathe. So let me go ahead and call the doctor. By that time, you're at the point of where you need to go to the hospital. But the hospital staff, but back to what I was saying, the hospital staff is, not hospital staff, Lord have mercy. The doctor staff, the doctors, a lot of time, they're understaffed, overworked. They're trying to manage a lot of chronic diseases, a lot of patients, and they don't have the manpower. And a lot of them don't know, they know what CCM is, but what I've been met with a lot is I just don't have the time or I don't have the staff to implement the program. But, like I said, everything builds from here. So those are things that, you hear a lot as far as that. But think about it, if there were more services available or companies available to reach out and actually build those systems and bridge those gaps, you would have more compliancy. Patients would have this trust of like, yeah, I'm heard, like I know they care about me, because not only am I seeing my provider, but in between the visits I'm getting monthly check-ins, and I also have access to this licensed professional 24 hours a day, whether it's via email, via a call system, and I'm going to get a call back and I'm going to get a response. Not only am I going to get a response, I'm going to get a solution, because a lot of times, a lot of the elderly community, especially in rural areas, they don't have access to doctors' office, especially public transportation, or they're living on limited income, so they plan their doctor's visits around when they're out doing their monthly shopping or however, so you have a lot of things, a lot of roadblocks in place. But CCM comes into play whereas they don't have to leave their home. They can make all of these complaints, or let their physician know about what's going on, whether it's medication issues or whether it's symptoms. you know you have a person who you have at arm's reach all the time. And the cool part is about this, physicians, they don't have to pay for it. Medicare pays for this program, and also the higher compliancy physicians have in hospitals, as far as with lesser readmissions, the higher reimbursements and the higher kickback you get from the different insurance companies. That's, like I said, it's a whole topic: kickbacks, reimbursements, bonuses. Like it's the system is set up for institutions to win, but people just don't have the information, or the information is there, but people, a lot of people don't like actually looking, because it does take a little digging. And I've been home with a broken ankle, so I've had nothing prior to this. I had already, learned everything it was to learn, because once I learn something or I'm interested in something, I like to learn everything about it. So I've just had time to like really strategize and figure out, like, how do we get this information out here? How do we get people to know like all of these programs exist? So, common misconceptions about CCM, which is chronic care management. Chronic care management is just a phone call. Even though I said yes, you're only a phone call away, and you do have someone who's constantly checking on you. It's not just a phone call. It's coordinated care, education, support, and it's patient engagement. A lot of times, you get patients who are not engaged and they don't care. Well, not that they don't care, they just feel as if they don't have anyone to care about them, and they feel as if, well, this person is just talking at me and not talking to me and explaining what's going on. So chronic care management fill in those gaps, because we can't expect one person to be everything to everybody, right? So we can't hold our physicians, up to this standard of, I need you to not only treat me, but I need you to, be the end all be all. They're not Jesus or whatever, entity you believe in, God or whatever you believe in. They're none of that. They're humans as well, and they also have issues. Myth number two: CCM replaces my doctor. That's not true. CCM supports your provider's care plan and ensure that between visits you're being successful and have all the tools in your toolbox you need to be compliant and also follow along with your care plan. Myth number three: CCM is only for elderly patients. We went over there earlier. Medicare beneficiaries qualify for this program regardless of your age. If you got two or more chronic conditions, you qualify for it. Myth number four: patients don't really benefit, only providers do. That is beyond false. Coordinated care improves outcomes and reduces avoidable hospitalizations. So, how can move? Thanks, mom. Um, so yes, if if we have all these teams working together and we can prevent hospitalizations, every person, I've never seen a person come to the hospital and say, "Oh, I really love it here. I'm having the time of my life." 10 times out of 10, I would say 9.9, because you do got your 0.1%. But 9.9 percent, 9.9 out of 10, I would say most people come in and they're ready to get back home. So with that anxiousness, you're gonna have like the rush to get out, like, hey, get me out of here. So you're not really hearing it. So this is the job of a CCM. Patients, you get to stay home and not go to the hospitals if possible. We try to prevent you from going in the hospitals and potentially, picking up some other bacteria, virus, or bug, in the hospital, because hospitals are for really sick people. And you, even though you may be sick, but we don't want you to be one of those really sick people. We want to try to control those things from home if possible. And myth number five: healthcare only happens in the doctor's office. Nope. Healthcare is every day. Every day, some of the most important healthcare decisions happen at home every day. We as a people, we're in full control of our health. Doctors are only there um, to control and manage, but we're the only ones who can fully manage and prevent, these things from happening. That's with diet and exercise. I like to always tell people, try not to watch TV as much. You sit down, you watch TV a lot, you become sedentary. Try to pick up some other thing to do. Me personally, when I was in the hospital, I tried to walk the stairs. Everywhere I went, I tried, to walk the stairs. The nurse who I trained with doing case management, Stacia, she was phenomenal. She walked the stairs. So I started doing that. And just, that little bit of movement changes everything. Instead of going for fried chicken, go for the baked chicken. You know, um, Instead of going for ranch dressing, try your own, homemade vinaigrettes. Like you cooking and eating healthy, what we put in our bodies is a manifestation of what comes out. So, you got a lot of colorectal cancers now, a lot of heart failure, a lot of kidney disease, a lot of diabetes. And it's like, people love to say, well, back in the day, grandma and granddaddy ate and they did X, Y, and Z and they didn't get sick. Well, that is true. But grandma and granddaddy also produced their own foods, meaning that they planted their own vegetables. The meats that they ate, typically they farmed and grew it off the land. So they didn't have all of these, genetically modified foods. They didn't have all these prepackaged foods. They didn't have a lot of sodium in foods. All these heavily processed meats. The most processed meat they had back in the day was what, deer meat, processed and wild game, which is lean meat, because those animals live off of the land as well. So, that's a big misconception as well. Like, I'm gonna eat like, my grandma and granddad did. Well, we can't. And especially myself now, you get to a point, in my mind, I always tell people I'm 21, forever 21. But realistically, I'm right knocking on 40. Hey, Mook. Hey, Uncle Mook. I tell you all the time, quit eating all that fried chicken. It's not good for you. Everything is okay in moderation, but we as a people, we don't know moderation. It's like the food has a hold on us. But like I said, me myself, nearing 40. Um, I have to be aware that my body is not functioning as it did 20 years ago. It's it's just not, that's just life. That's the life cycle. The older you get, the more you're going to change things. And we all have our vices. I'm not saying that I'm perfect because I'm not. I have my vice. I like sugary drinks. I like sodas. I try to cut them back. But I mean, for now, I'm okay because I don't overdo it. But I do like a cold Coke or Mountain Dew here and there, but I don't have it all day every day. Um, Raw vegetables. If you can eat, raw vegetables, raw foods with your kids. I always like to tell people try. I can't convince people what to do with their kids. If you can, try not to give them processed foods as much as possible. So that way they won't have to build a habit in adulthood because they've been nature they've been nurtured into these habits, with psychology, nature versus nurture. Some things you can't prevent nature wise, like some people are predisposed for certain cancers, predisposed for certain diseases based off genetics. You can't outrun genetics, but we can nurture in good behaviors. We can learn good behaviors, and we can train and teach, the younger generation good behaviors. So with my kids when they were younger, I tried not to give them as many sweets. I always let them eat unlimited fruits. Now it's coming back to bite me in the behind because fruits are very expensive, and my kids will blow through $100 of fruit in yeah, a couple days, not even a couple days. Like we eat anywhere from 9 to 12 pounds of bananas a week. Thankfully, we're Costco and Sam's members, so that helped us a lot. Edwin, most definitely, I would be honored to come on your platform. My goal with this is to go out in the rural areas and do speaking events. And, my thing is people like to always charge for this information when I believe in planting good seeds, and the seeds that you sow, they come back to you. I've read this information and I've learned it myself, and I just love sharing the knowledge because who know who life it can save, and who know who I may need in the future or where I may end up. And someone may, have heard me or, you know, gain knowledge from someone that may have heard something that I've said, and they were like, dang, you're that person. So thank you very much, or whatever. It's not even for that. It's just fulfilling to be able to do something that you love and be able to help people. And like I tell people all the time, no one should get in the healthcare field if you truly don't love people. Whether it's bedside nursing, whether it's doing case management, like where on my side, where you have to understand. I think, well, you have to well, not think, I know, to be a great case manager, you have to be a great nurse. And greatness, however you identify greatness, to me, greatness is being a good human being. Not, not, don't treat people how you want to be treated, because you may want to be treated like crap. Treat people better than you would treat, um, than you would want someone to treat you. So always go above and beyond, not because someone is looking at you, but because that's the human thing to do. And a lot of times, a lot of people in this field, they think, I'm gonna make all this money. The money for the work that you're doing doesn't add up. I mean, in Alabama, it just doesn't add up. So you truly have to love what you're doing. Um, Hi, Terry. Yes, Bernita. Thank you so much. I'm going to be doing these lives twice a week. And also, if you guys have any questions, you can pop them in, and I'll come back with like short videos highlighting the questions and answering them, because it's too much information to give like give like all of it at one time. That's why I'm doing like series and doing videos to answer. But yeah, back to what I was saying, if people could be more caring and willing to help people, then I think the world would be a much better place. So I can't change the world. When I went to nursing school, I wanted to um, make a change in healthcare. I love research. The research that I did was fetal and maternal mortality rates amongst African American and minorities um, in the United States. In Alabama and Mississippi have one of the highest ratings. So, all of these things. So I love research. So happened, God's design, I was placed in a position and in a role where I found my niche early on in my nursing career. I'm not a person who settle, and I always like to tell new grads if I can talk to them, my best advice is don't settle and stay somewhere, you're unhappy. Find your niche, because if you're unhappy, you're not going to be that great of a nurse to the patients or the people you're providing care for. So find the area that you love and the thing that you love to do in nursing, and be great at it. So that way, we can actually work towards, healing people, and just, doing the basic of loving on people. But anyway, that's my whole humanistic tangent, because I don't know. I have faith in humanity, but hopefully the next generation will bring that faith, and help build us into a better people, because right now, I don't know, humanity is kind of falling off the bandwagon a little bit. Um, but yeah, but CCM is like an amazing program. Like I said, I really found my niche, and I just like, I mean, ah, getting tongue tied. Lord have mercy. I have 10,000 thoughts going through my mind at once. My OCD is taking over, but my goal is to go out in the communities, especially with me being in Montgomery County, and seeing a lot of the patient population and talking to them. Like I see people now in the store, they be like, "You the case manager from Jackson," because if you at Jackson and you was out 3 West, then I was the case manager. Like I'm gonna go above and beyond for you. And I truly, truly love all my patients, and I didn't like stopping until I found a solution. I don't like losing. I hate losing in life. I'm not a loser. So that translates over into me being a case manager. So the thing, when people say no, I always find a way to get a yes, with patience. So, you have to have that type of mindset in this area. And a lot of people probably think, oh, this chronic care management thing is really easy, or it doesn't seem like a lot because you're only following a certain script or whatever, but you really and truly do have to care about people. Yeah, it can be lucrative. Yeah, it can do X, Y, and Z, but as a person, you have to care about people and hear their concerns. And also, as a clinician and that middle ground person, you have to be able to put the pieces together. I absolutely love pathophysiology. Shout out to Auburn University in Montgomery, Dr. Courtney Cochran. Hated her class at first. Love her. Amazing. I love pathophysiology. So being able to go over, being able to correlate the different disease processes and put together those symptoms. A lot of people hear shortness of breath, you think respiratory issue. Oh, shortness of breath, they're having a respiratory issue. But no, shortness of breath can be a lot of things, so you have to be able to piece those things together. Abdominal pain can mean a lot of things, but you get what I'm saying. You got to be able to paint the picture and be able to put it together. And I feel as if a great case manager is not only, or a great chronic care management team is not only someone who understands the clinical side of it, but someone who understands the insurance side of it, and someone who's very passionate about helping patients and being preventative, you know, with the care. So, chronic care questions, like these are just things like engagement wise, stuff that, whether you're on here now, you want to respond in the chat and put up a question, or whether I can come back later and respond. So, how many medications, if you do have chronic conditions, and if you don't want to put it under there, that's fine. You can inbox me and let me know, and then I can put it up, do a video and do it anonymous or whatever. I can do an anonymous poll if you don't feel comfortable. No judgment here, because a lot of people I know don't like people being in their business, or don't want people to know, how sick they are, which is, fine. But I also know that you're not alone. This is absolutely no judgment zone. If you are a clinician and you've made patients feel as if, they're less than, or they're being judged for the things that's going on with them, then shame on you. Because our jobs, and we take oaths, is to educate the people and make them feel comfortable so they can come to us for help, and we can help them and hopefully heal them. Maybe not, completely heal them, but get them to a point to where their conditions can be managed. So, how many medications do you take every day? Does anyone on here manage diabetes, high blood pressure, heart disease, or COPD? And what's the hardest part about managing these chronic conditions? And I guarantee you that last question, the hardest part about managing it, everybody's gonna have the same answer. Same answer. Most of the time, same answer. I'm not gonna say, but I'm gonna let you guys, put down there what you think or what you feel is the hardest part, or whether you just simply go to the doctor and you're trying to reach out, with a follow-up question, you know like what's the most annoying thing about it, calling and trying to reach them. Like what's the issue that you typically run into? Either it's you're waiting a day or two to get a response, or sometimes you don't get a response at all because things get lost in the sauce, because doctors' offices can be chaotic, especially if you got a chronic condition such as heart failure or anything like that, because anything can happen at any given moment, which can cause that provider to be pulled away, whether it's emergency surgery or having to go to the hospital for an emergency or whatever. So, more questions, follow up care questions. Have you ever left a doctor's appointment and forgotten half of what the doctor discussed? Have you ever missed a follow up appointment because life got busy? Also, what's the biggest healthcare challenge your family has faced? Whether that's your family, it doesn't have to be your family. If you don't want, like I said, understand people are private, or either it could be someone that you may know. Like, what's the biggest healthcare challenge that your family has faced? Have you ever felt like you were trying to navigate the healthcare arena alone, or you were trying to navigate like your diseases or your health conditions by yourself? And what's one thing you wish doctors had more time to explain? So, and all of these questions is giving me feedback and data to use as well for when I speak with physicians. These are things that, they hear these questions, but if you guys could, put it in the comment section, then everything is based about data. We can preach this all day, about, what we need to do, but unless you have data to prove it, then it's useless. So, yeah, help me get the data and put it down there. Like I said, it doesn't have to be yourself. You could just say it's someone, however you want to do it. Also, because I'm coming to an end now, I've been on here 47 minutes. It was only supposed to be 30 minutes. What was the biggest thing you learned tonight? And would you like me to explain what is HIDUS and star ratings next? So I spoke about that earlier, and that goes, like I said, into the compensation and reimbursement arena and facilities, being compliant. So HIDUS is HEDIS. Those scores are not available to the public, but physicians get them, and it's based off of different metrics. Those metrics include some of the metrics include compliancy, whether it's medication, follow up appointments, um, not having in rehospitalizations, preventative care, everything that falls under CCM management. That's what determines a physician's HIDUS score. So your HIDUS also determine private physicians' reimbursement and bonuses at the end of the year for their practices. So Medicare, I done got off topic. Don't supposed to be talking about this, but I'm just gonna go do a little spiel, just so that way you can come back and get like the full scope of how it actually works. Providers, I encourage you to come follow up, because I know you guys are busy, and we, like I said, a lot of people have problems, but no one is, or complaining about problems, but no one comes with solutions. I'm very solution oriented, and the information is there and it's free. I always can give you the links, information to where you can go to the Center for Medicaid and Medicare and Medicaid Services yourself and read and verify on your own. But so the highest scores, they pretty much physicians at the end of the year. Medicare, Alabama is pretty much in rural areas controlled by Medicare. The aging population, chronic diseases. So what Medicare do is they give physicians, they pretty much give you this money. You get this money to provide this care. They pay for all of these things, and your job is to educate, provide care management, spend so much time and appointments with them, do preventative care, all of these things. Well, doctors do that at the visits. They go over all these things at the visits, but the gap where CCM fall come in to play it is the follow through. Patients don't follow through. Once they sat in that office waiting, to see a doctor, and they've spoken with the doctor, they're like, good. Don't have to come back here until 3 6 months. Not worried about it. Out of here. So the follow through to do it is just not there. So your money and your kickback comes from people following through with it. Like how many patients, who qualify for Medicare on this are getting mammograms, who's eligible for mammograms? How many patients are doing colonoscopies? How many patients are doing cardiac screenings? How many patients are doing, all the different and various screenings that you do. Like how many patients are being compliant and doing yearly annual. So this is how insurance is billed. And sometimes, it's unfortunate. Medicare comes back and they take their money back. And that's what happened with hospitals a lot of times too. They pay, they reimburse you for things, but if you can't justify it, or you may have done the job, but you can't provide the justification because there are these gaps, and Medicare wants their money back. The insurance want their money back. So yeah, that's how high this go. The star ratings is also that's just saying that you're really compliant. Also, I could be getting them confused because, like I said, it's so much information. But the star ratings is just saying that your CM is compliant all the way across the board. Hospitals are compliant. They're doing what they're supposed to do with Medicare, and you're like one of those ones. Like you're a hospital and you got like a 4 star, then or a facility, like you're doing an amazing job. Your care team and your people behind the scenes are doing what they should be doing. And the thing is, I feel as healthcare in other facilities, they should reach out to these facilities who are being successful, and just try to come to a mutual agreement and try to figure out like what is it that you're doing, how is it, what is it that they're doing and providing that I'm not doing, you know. But like I said, it that takes a lot. But we start off slow and we start off small. I'm one person, but one person can make a difference here locally. My plan, like I said, is to educate. If people only understood the importance of something as simple as just keeping up with your blood pressures. Not saying that, oh, I'm only 25, I don't have high blood pressure. Doing all of the simple things, and they'll understand, the importance of the small thing, well, how the small things eventually could lead to big things, and how being preventative now could prevent you from having, major health issues down the line. Um, but yeah, I hope you guys, like I said, gain something from the live. Tonight was my first time doing this, so I may have been like a little bit over the place, but I'm sure the more I do it, the better it'll be. As with anything, you just got to put yourself out there and do it. I know the information, and I love what I do, and I love talking about it. So I can start talking on one thing and it'll just keep going and going and going. So that's why this is going to be like a whole series as far as with chronic care management, and if you guys want to hear about certain topics, or, with Medicare, and like I said, I'm on the insurance side. Don't I'm also clinical side, but I also understand the reimbursement in the care management side, and those everything go hand in hand. Um, as far as like the utilization review part of it and all of that, um, patient denials, when a lot of people like, oh, my insurance denied X, Y, and Z, or they want to prove this, that, and the third. A lot of times it's because, thank you, mama. A lot of times it's because the documentation. Um, Documentation in healthcare is everything, but also that documentation takes a lot of time. So, health, like I said, healthcare is ever changing. To be in this field, you have to be open and you have to be willing to grow and learn. Because every day is you're learning something new. Once you graduate from nursing school or you graduate from medical school, your learning never stops. Science is always evolving, and as a nurse or as a doctor or any type of licensed professional, your job is to always learn and always stay with the time, because over time, evidence-based practices change, the way we do things change, requirements change. So our job is to know those changes and understand those changes and implement those changes, and hopefully we get the outcomes that we're looking to get. So before I close, I would like to close with this one thing. Remember that health care doesn't happen only during appointments. Real health happens in the days between them. Until next time, I want you all to stay informed, stay proactive, and stay healthy.